usichoke wala kuwa. Mwili wako ni gari, akili ni ramani. Safari ya maisha lazima iwe safi. Twende sasa, tusonge mbele. Nguvu zetu zishinde vikwazo. Fanya mabadiliko, leo ni siku yako. Jipe moyo, tembea kwa mwanga. Fanya mabadiliko, nguvu zako zinatosha. Pamoja tunaweza bila shaka. Mazoezi ni mbegu, afya ni mti. Ukikimbia na kucheza, mawingu yanafutika. Akili yako itulie kama maji ya ziwa. Furaha inakujia bila hata hila. Twende sasa, tusonge mbele. Nguvu zetu zishinde vikwazo. Fanya mabadiliko, leo ni siku yako. Jipe moyo, nguvu zako zinatosha. Pamoja tunaweza bila shaka. Mazoezi ni mbegu, afya ni mti.
Love that song. I just needed to highlight that. We're ready to start, team, right? Colin? But ladies and gentlemen, I love this song, so we might as well play it and then call it a day. Colin, we can officially start now. Love it. Haven't sequenced up the music? Perfect.
Okay,
It is lovely.
Liz,
I would
can you hear
love
me?
to listen to it like 100 times over. So send me the link to that hit. Collins, I believe you're going to start off, but ladies and gentlemen, welcome. We're going to have it out of this world sort of a conversation, especially for communities. If you're from the civil society and communities side, this is sports, health, partnership, you name it. So it's going to be one heated conversation. It's a round table. That means whoever has joined in has interest in the discussions for today. So I will hand over to our lead, Collins from YIDP, to kick us off. Over to you.
Thank you so much, Liz. I'll just pause a bit and I'll ask Kevin to take it over for like 2 minutes, then I'll join. Okay. You're on mute, Kevin. All right, I think it is technology. Anyway, ladies and gentlemen, good afternoon, good evening, good morning from wherever you are joining us from. I'll take a moment to take you through housekeeping rule because since Corona, I think this thing we are used to it now. And our audience delegates, everybody will be on mute for the time being. This is 1 hour, 30 minutes dialogue or round table. So we expect we'll appreciate your contribution. And also you will be told when the forum will be open for the delegates. And I think that's all for the housekeeping rule. And the session will be in English. So we are very sorry for Anglophone. But in our next session, we'll try as much as possible to have translator or translation. So good afternoon, esteemed guests and partners, once again, and panelists and fellow architects of the future. I'll take around 5 minutes of giving opening remarks. So on behalf of Youth Initiative Development Program and our partners, I welcome you to this crucial conversation. Let's be clear about what's at stake today in today's life. I would like to give a bit of story. Imagine a 16 years old football prodigy in a rural village in Africa, and he has a gift that could change his family's destiny. But a simple untreated ACL tear on a dusty pitch ends his dream before it ever begins. Now imagine a talented young female runner shouldering the immense pressure of her community's hope. She does not quit because she lacks speed. She quits because of the crushing silent weight of anxiety. There are not isolated stories in our community. These are not isolated stories in our community. These are data points representing a massive systematic failure. Let the numbers paint the picture. Over 60% of Africa's population is under the age of 25, the largest youth demographic in the world. This is our greatest asset and our biggest market. Yet the World Health Organization reports that our continent has one of the world's most severe health worker gaps, with as few as one mental health professional for every 500,000 people in some region. We are losing our future champions to preventable injuries and unaddressed mental health challenges. This is a profound social tragedy, but I want to frame it for what it also is a massive market inefficiency and a significant investment risk. The good news is we are not starting from zero. The Africa Union's Agenda 2063 envisions a prosperous continent. Our national government have youth and health policies. We are aligned with the Global Sustainable Development Goal 3 for good health and well-being. But here is the critical gap these policies alone cannot fill. The last mile delivery mechanism. How do we get these noble ideas from paper into the real lives of young people? The answer is hiding in plain sight. It's in the very place our youth gather with passion and trust, the sports unit. I'll call it the youth safe space. This is why we are here. This is why we are building towards the Sports Wellness Summit, which will happen in November this year. And our mission is to transform these thousands of sports clubs, academies, and community fields into frontline hubs for a holistic wellness. To integrate primary health care and mental health support directly into the fabric of sports. The summit is not another talk shop. It is an economic and social imperative designed to produce a bankable, scalable blueprint where private sector investment finds a new high impact asset class in youth wellness. Healthcare providers find an engaged captive audience. And most importantly, our young athletes find a safe space to thrive both physically and mentally. Ladies and gentlemen, I am honored to have our moderator, who is Ms. Liz Otae, and our distinguished speakers who will guide this essential conversation or work. You are not just a panelist, you are a co-author of a new chapter for African sport. Let's begin. Let's build a pathway that turns potential into enduring success. Thank you so much, and over to you, Liz Otai.
Great. Thank you, Collins. I mean, so that's our interim CEO and co-founder of Youth Initiative Development Program, who's actually organized this particular virtual roundtable. And the reason why he's insisting on this not being one of the mini webinars we used to, it's because If you're joining a virtual roundtable, that means you have your input and your needs to be heard, and that's what we're trying to do here. But we also have experts who are going to be speaking on behalf of today's theme. But this is like a pre-discussion we're having before the actual Sports and Wellness Summit that will be later on happening in the year. And of course, the team behind this will be sharing more details around that. But if you've bumped into the webinars I moderate, you know it's mostly around health, civil societies and communities. This is a little bit gray area for me, and that's the reason I'm looking forward to just enjoying taking a back seat and kind of listening into the three experts that are going to speak. I mean, we're talking about African athletes. We've just had the term mental health, and that's one key issue that we're facing as a continent, but also having events that mean and bring, impact into other people's lives is what YIDP is trying to do. So I'm going to be your moderator today. I'll do less talking, more moderation, because as I mentioned, we have key experts. But ideally, as the continent, as the African athletes continue to rise on global stage, there's need to support their health and well-being. And that's what, if you know ENA, so that's what we're in for, advocacy around health and equity and equality of health to everyone within the continent, regardless of your background. And today we're giving it a more focus on the athlete side, and we want to see how communities and private sector can actually chime in and bring in their expertise. But we're looking at this one overall theme, which is setting the stage, building sustainable pathways through sports, health, and private sector investment. And we're not fooling anyone, because the whole discussion that has been happening from the beginning of this year is sustainable investment. We're all feeling the pinch, and we're trying to figure out how can we undo what has been done, and how can we come up with sustainable ways of doing what we've been doing for quite some time. So we'll just dive into the discussion, and I'll call upon one of the speakers. Next slide, please, if you don't mind. So as I mentioned, this is a gray area for me, but what I know is the three guys who are going to speak are experts in their own right. So I'm going to call upon the first speaker who's going to deliver the keynote. And I know she has a presentation, a PowerPoint presentation that we're going to also kind of put up. So if the team is ready, and Dr. Pamela, are you also ready for your keynote? Just double checking if Dr. Pamela, you can unmute yourself.
Sure. Okay.
Perfect. There you are. Now, ladies and gentlemen, I'll give Dr. Pamela a brief minute to introduce herself, because what I know is nowadays, especially our doctors, they have a lot of hats that they put on. But I know Dr. Pamela is actually the president of the International Society of Substance Use Professionals. So I'll let you introduce yourself so that I do not butcher, first of all, your current position or even your last name. I wanted to pronounce it, but I have a problem with R and L, so I don't want to butcher your name. But over to you, Doc. You can take it over.
Thank you, Lizzie. Good afternoon, good morning if you're in another time zone. And I am so glad to be here this afternoon. My name is Pamela Kaiduru. It's not a complicated name. It's Pamela Kaiduru. I am a psychologist, an addiction professional. I'm currently leading the ISAP Kenya chapter, that is the International Society of Substance Use Prevention and Treatment Professionals. We are a global network of professionals in the space of drug demand reduction, where we bring in about 45,000 now membership globally within 39 countries. And ISAP is a membership organization bringing any professional, the faith-based organizations, the government employees, the youth, the young, the old, anyone who is involved in the space of speaking around issues, substance use. We have very good curriculums that run online on universal prevention curriculum, universal treatment curriculum, universal recovery curriculum, specialized courses that anyone can take and be able to operate in the space that they are interested in. Because we know all of us have different workplaces, have different communities that we speak to. So once you do the common courses, then you have the freedom to do the specialized course that fits the space that you want to operate in. I want to welcome us all to ISAP because it is our day course, knowing especially what is happening in our continent now and even in Kenya around substance use. Knowledge is power. It is important that we build capacity so that then we can be able to undertake prevention. And especially when we are talking about sports, we need to empower our people to build identity and to be able to utilize the opportunities that they have, because it's not only about medals and milestones. It's also about ensuring the health of the athletes is taken care of, especially knowing that at times they have a lot of pressure to perform. There is injury that happens. Professional psychological support is very, very important. And this discussion, we hope that it could be able to speak to policymakers, speak to sports federations, to education sector, to our parents, to development partners, and to the athletes themselves, the ones currently and those who are intending to or building their skill towards it, so that then we can ensure that we model the right behavior and we support our athletes to be able to give us utilize this big resource that we have in Africa. So I'm going to make a very short presentation on adolescent wellness and substance use prevention in sports development from an African perspective. So you can draw my slides. I will make it very brief because I'm basically just creating a dialogue for us. So I know when we talk about adolescence, according to WHO, it is the age between 10 and 19. And this is an age that our young people are growing physically, they are growing cognitively, they are growing psychologically. There's a lot happening around their life. And at times they are very vulnerable. It is a period that growth is happening in virtually around and in this person. And sports is key in Africa, especially as we see there's increasing growth in uptake of sporting activities, and various institutions are building our athletes. It is becoming a business, as it were. It is developing the economies of countries. It is supporting families. So we need to be able to focus on this, because if we don't safeguard our young athletes, they get exposed to harmful substances and, of course, develop psychological conditions that will make them limited. Let's move to the next slide. Whoever is moving the slides for me, please. Well, good. And when we look at the African sports landscape, it is a growing investment, as I was saying. There is high participation at school, at community level, a lot of competition that is happening. But also we are faced with a limited access of structures. As Collins was saying, you find a young person who gets limited, not because they don't have the talent, but because the resources around them do not allow them to be able to exploit their talent. So, and this limitation is not only on the structures for doing the athletics, even the psychological issues that they face can actually make them lose their way, and therefore we find them dropping out, we found them underperforming, we lose them along the way. And the emerging drug use among the youth, among the athletes, is a concern. And especially for Africa, when we look at it, how many times our athletes who are very outstanding, very talented, but being caught up in doping situations, dropping out because of substance use. One gets the fame in one athletic event, and in the process of celebrating, starts using substances. And that is how they loot. They get lost along the way. Let's move to the next slide. And therefore, we need to really look at it from an African perspective so that we don't lose this growing resource. As we talk about Sustainable Development Goal 3 on health and well-being, we know they are all interlinked. We are looking at growing a population that is energetic, a population that is healthy. Then substance use is coming to actually make them not do what they ought to do. What are the risk factors and the drivers? At times, the performance pressure that we put on them. Remember, some of them are doing this for their institutions, their primary school, the secondary school, the colleges. They are putting pressure on them to perform because it means mentors to the organization. The pressure by the coaches trying to make them do the best, of course, so that they can be able to achieve and shine, not only for the organization, but also for themselves. The peer pressure they face amongst themselves. Imagine if one of them is using substances and is luring others to initiate. That becomes peer pressure influence that can actually cause them to resort to substance use. Family issues. Some of our young people are either orphans, they are facing difficulties in education, they are living in turbulent neighborhoods, a lot of violence happening, and of course it has a way it affects the health and wellness of our young people. And at times, as a way of coping, they resort to substance use. The lack of mental health support and the coping mechanisms around the youth. We find that this has not been ingrained in the sporting arena, so that we are emphasizing more on the physical well-being, on ability to perform in your sports. But what of the mental health of these people? It becomes a risk. There is social media influence. Substance use is being depicted as if it is a good thing. And behind the scenes, really, we know the damage it is doing. Spirit, soul, and body. We have very many mental health conditions that are resorting related to substance use. It is also influencing the physical well-being, the injuries and unregulated use of painkillers. You know, painkillers also can be abused and they have their impact on the health of the person. The socioeconomic inequalities that our athletes are found in. You find that they have gone to sports. One of them has all the attire. The others just comes almost in barefoot. And they have to compete. Some of them are feeling embarrassed. Some of them have to resort to various other ways of coping that predisposes them to using substances. So we find that there are a lot of risks. I've just enumerated a few. There are a lot of drivers of use of substances amongst our athletes. And at times the society around them may see, and we may not say anything. And at times we leave them to their own world, and we lose them along the way. The next slide, please. When we look at the health of when we look at athletics, we want to look at it wholly. We need to focus not only on the infrastructure, not only on the physical performance. Did they get number 1, 2, 3? Do they bring medals? How are they? Do they have injuries? The physical well-being alone is not enough. We need to look at the dimension of mental health, the emotional health of this person. How are they nutritionally? Are they eating unbalanced diets? Are they resting enough? Are they aware of the substances that they are in, that they can easily fall prey to? Do they have life skills to manage their life? Are there supportive relationships? These are things that we need to speak to. Supportive relationships from the the sporting fraternity, supporting relationships from the institutions, supportive relationships from the family, and even amongst the peers. That is the way we can be able to focus at the holistic well-being of the athlete. Next slide, please. And when we do this, we have to put in place preventive strategies. We know prevention is always better than cure. So, as we look at the policy interventions that are being put in place, always we find we are looking at how to enforce doping strategies so that our young people are not using substances. What are the regulations around performance? What are the regulations around national sports authorities, and what are the protocols that should be adopted? Those are policies that we put in place. The next slide, please. Beyond those policies, we need also to focus on the psychosocial support. Embed sports psychologists and counselors in the trainings, in the camps. We train our coaches also and the teachers on basic mental health and substance use red flags, so that they can be able to tell when a young person who is an upcoming athlete or even their own celebrity that they are building is getting to a point of initiating. We need to have a people around them, a pool of people who have the basic knowledge about substance use, about mental health, so that they can offer the necessary support to these young people. We need to have psychologists and counselors available, that the sports people can be able to know we have a referral system. We have a facility that as psychologists. We have the HISAP that as in Kenya already we have well over 2,000 of us that can be able to offer the service to our athletes so that we stop losing them to substances. They also are human beings who have families, who have other problems. It's not only the athletics that may be causing them psychological issues, family issues, education issues, financial issues, violence in the community, their own performance. All these things we need to have a referral system. And that's why ISAP comes in very handy to be able to give support, psychological support to our athletes. Peer education and role models. We need to build around the athletes role models that they can learn from. The Honda athletes, the fraternity that they are working with, to be able to help them to move forward. The next slide, please, that I can move faster. So what are the challenges in Africa around our athletes? The resource limitation, especially for rural athletics, for undeserved areas and areas that have harsh climate, where there is heat that is high temperatures. And this athlete has to be practicing. At times it causes them psychological distress, and they will likely resort to use of substances. These are things that we need to think about. The culture, the silence around substance use, the inconsistent data. We need to research and understand from an African perspective, what are the risks? What are the available resources? What are the gaps? What are the intersections, so that we can be able to support our people? Let's move forward. So it is not an easy job. It is just like you see somebody lifting a heavy weight. We have a heavy weight to lift in Africa to be able to empower our young athletes. Next slide, please. So the opportunities are there. We can develop regional collaborations for safe sports. We can have a framework that speaks to sports and psychological wellness, sports and mental wellness. We have opportunity to develop our curriculums and integrate life skills, especially around substance use, around mental health and wellness in the curriculums for the sports. We need to have public and private partnerships that are investing in sustainable sports. And of course, local support and community-based initiatives that will be able to engender growth in the sporting arena, especially for our young people. And of course, there is nothing for anyone without them on the table. That's why we need also the adolescents, ambassadors to be there. We need the young people themselves to have peers amongst themselves. We need them to participate so that they can put their voice on the table. It is not a top-bottom approach. It should come from them. What are their needs? How do they think these needs should be addressed so that we have feedback that is available to influence policy and to influence practice? The next slide, please. I'm almost done. So, what is my call to action? My call to action is let us invest in safe, inclusive, and empowering sports environment. Africa should be able to arise and ensure that there is safety, there is inclusivity, there is growth and empowerment around sports. Invest in the infrastructure, invest in the individual, invest in their mental health, invest in their physical health, invest in their growth and development, so that we are not looking at only the financial gain that they bring, the fame that they bring, but can we have this person be productive as a young athlete and still we see them in their 60s? When they left athletics, they are still living a good life. We are not going to lose them at their 40s when they are dropping out of the athletic life. So we need to have a holistic person, a holistic approach, and great investment around sports and health and wellness. Why is it very important? Because as we talk prevention, it is not about saying no to drugs. It is about saying yes to healthy futures, to a wellness culture, and to a youth voice in developing sports in Africa, so that then we can benefit the individuals, benefit the institutions, benefit our nations, so that we look at sports as a business that is sustainable and that is giving long life to our people. The next slide, which is the last one, I really want to say thank you, and I hope this will create an environment for us to dialogue around the importance of the health and well-being of our athletes, so that then we can have them be productive. They can also benefit from the talent that God has given them. They can get value from this service that they are rendering to our continent. As I say thank you, I also want to leave you with the contacts for ISAP in case you will be interested, which I want all of us to be interested to belong to ISAP, so that we can build our understanding around health and well-being in terms of substance use and psychological well-being for the better of our young people, because we are with them at the family level. You are growing this young child so that they can become a better athlete. This foundation begins at the family. If there is trauma from the family, it will influence that child. It will make them not gain from their sport. If there are conflicts at the family level, if there are psychological issues that are not being and affect their destiny. Thank you, and God bless you.
Thank you very much, Doc. I mean, first of all, when we started off, I was very much interested in the background because it looks like where you are, it's very sunny. But then as we've been progressing, I like the way you brought it up from the adolescent aspect, brought in the family aspect, and how all of us can actually play a key role in making sure that young athlete gets all those, things that they need in order for them to last longer in the industry. Because I've been thinking about most of our athletes, you've had their stories. There's some of them have been mad at that. But if you've watched Kipchoge's Netflix inspiring story, some of them are also trying to impact good knowledge and even, good behavior by sharing their experiences and what they've gone through into making sure that they become recognizable athletes. But thank you very much for bringing in that particular aspect on how adolescents, sports, and mental health. And it's something that we've been giving it kind of a slight discussion on it, because from African perspective, when you start talking about mental health, we think you've lost it, or, there's a witch doctor or one of our in-laws has done something wrong. We normally have a lot of things trying to understand what mental health is. But when it comes to having a healthy adolescent who's an athlete and just trying to make sure that holistically they continue, growing their gifts and their skills, we really have a lot of things that we need to put in place. And thank you very much for also bringing that nexus between climate change, health, mental health, sports. Thank you very much for just making sure that we get that particular aspect on how everything is connected. But what I like, and this is what I started off, the minute you bring that clear picture on how we can involve communities and civil societies and community-based organizations and initiative, that's where we go right, because you have to include the communities. But ladies and gentlemen, as I mentioned, talking about health, we're talking about sports, we're talking about investments, and we have our second expert. So thank you very much, Doc, for that input. And I'm hoping it's okay for us to also share your PowerPoint slides, because I know people will be asking for it. We have Dr.
That's okay.
Nicholas O. Okumu. I'm not so sure, Doc, what the O stands for. So Dr. Okumu, if you're still there, he's a consultant orthopedic surgeon, a global surgery advocate. So he literally knows what's going on. Doc, there you are. Lovely to, virtually meet you, but also looking forward to your presentation. But 1 minute, we just go back to the main presentations. So ladies and gentlemen, as I mentioned, I'm not an expert when it comes to this, but the speakers are, and I'm learning as we go, but I'm looking forward to Dr. Nicola's insights on how we can actually, create pathways, not only for sports, but also make sure that there's sustainable investment in this particular department. So over to you, Doc. Thank you very much.
Hi, I hope I'm audible.
Loud and clear, yes. And my apologies, you might have to introduce yourself, because I'm not so sure whether this is the recent title or there's another, I'm a father, a husband, an uncle, sort of a introduction that you'd want me to do. So over to you.
No. I think the introduction you've given is sufficient. Hopefully it tells people that I'm qualified to talk about what I'm going to speak on, and the rest will come as we go. I'm not sure if my screen is visible. You just tell me if that is also the case.
Would you like to share your presentation?
Yes, I have
Okay,
actually.
so I'll just let our team, stop sharing their screen so that Dr. Nicholas can actually take it over.
Just let me know if it's visible.
Almost there, just 1 minute.
Yes, it is. Go ahead.
There it
Okay.
is. Thank you.
Cool. So if you can see what's on the screen, it's just a small visual to help us along the way as we discuss, I guess, the medical aspects of athlete wellness. And what I'll say is, to begin with, is that too many African athletes are celebrated at their peak, but often forgotten afterward. And the challenge isn't really a lack of talent, but a lack of what we call a supportive ecosystem. And we must find a way to shift from, this episodic kind of elite only care to something more comprehensive, so that every athlete at every level is taken care of. And if we talk about the gap, this kind of small graph here tells you that only a very small section of athletes in our countries actually have what we'd call full support. The bigger majority don't actually have any support from, I would say, the existing structure. And there are 4 critical steps that are missing. We don't handle them in terms of injury prevention, comprehensive rehabilitation. Something has already been discussed about psychological support, and that mental health resources are really important for athletes. And then after they retire from the athletics, that post-retirement care, it also does not really exist. And so we need to build a collaborative ecosystem, which includes the private sector, the public sector, and other players, so that we can address these issues. As I'm speaking to you now, I'm a project lead at Kenyatta National Hospital for a project we initiated, which is to build a center of excellence for sports medicine. And that is actually part of our strategic plan for the next 5 years. But it's not something we can do on our own. We need partnerships to be able to make this successful. And the partnerships we're talking about is from insurers, sports federations, tech firms, the athletes themselves, so that we can have a comprehensive athlete wellness ecosystem. And even before you're able to do this, you need policies that are enabling, to unlock the kind of investment that is required. If I was to give you just a ballpark figure, to build a sports medicine center the way we're envisaging at KNH will cost us around about 2.5 billion shillings to start. That is not factoring in anything else, to do with the future. And so we need to kind of attract private sector capital and innovation, and the policy environment must make this worth investing in, so that, at the end of the day, everybody can come out with what we call a win-win scenario. And so what types of things do you need? You need funding from the government. We already have in place something called a sports fund, but is it doing enough for the sector? We need to have insurance covers for the athletes, and hopefully this can even be compulsory. We need tax incentives, and we also need inclusion of this in our universal healthcare plans. So the long-term strategy is to build systems and not centers. You don't want just one facility and you say, we have a center of excellence at KNH. We need to build systems. And our plan is just a blueprint. It's not, the vision is scalable. It can become a national system that supports athletes throughout their entire life cycle, right from the time they're in academies all the way to the time they retire. And the kind of pillars we want are, yes, we'll establish the center of excellence, but we need to expand that network. And that means satellites in partnership with, universities, private providers across the country. We need to integrate this system digitally so that it speaks to it, people are speaking to each other, not siloed. And we need to create a lifelong support, including even a pension for our athletes. I don't think anybody has ever thought that, and I think in terms of career, athletes are the people who will work for the shortest period of time. I think even our best, the maximum they would work until is about 40, 45 years. So we need to build systems that allow, these guys to be well even after they retire. So in essence, that's what we are saying, that we need to build an ecosystem that takes care of our athletes. I will just briefly mention one or two things that we can do to sorry. I'm trying to get something sorted out. Sorry. So we've talked about the broad things that we need to build, and I would say therefore that we just need to then work on making this a kind of ecosystem that we can that will fully support our athletes. And I'll end with a quote that says, Africa doesn't need elite athletes. We need healthy, whole athletes. And that's before, during, and after their careers. So all these things that we've talked about and partnerships with the private and public sector and well-designed policies are the tools that we must encourage that be built And we must bring to this discussion courage, vision, and urgency. I think I'll stop there.
Thank you very much. And I think there's just one particular phrase that looks like it's actually hit home, which is building systems and not centers. And I would like to also just see our own athletes who have been successful take major roles and become champions of such kind of initiatives. And yes, no to one center. We need to make it a sustainable system so that if one center works, then there's a blueprint on how the second center can be implemented. But it will be good. I mean, I know you've called upon building system and not centers. And I know the people you're targeting are insurers, sports federations, governments. You mentioned about the sports fund, but I'm also seeing our own athletes. They do make a lot of money. They do make a killing from what they do. So I would also love to see them, like want to mentor the young sports athletes that are coming and the young adolescents who are also very ambitious into, walking in their own footsteps, for them to just take that initiative, not only to mentor them, but also make sure that the difficulties they faced, the other guys who are coming after them will not face the same difficulties. They need to speak up more. I feel like our own athletes and sports people need to speak out more on the issues that they go through. What we normally receive, especially in Kenya, is a story after they've gone through, the mental difficulties, they've been hurt. Then we hear the stories later, but we'd like to take that journey with them. So thank you very much, Doc. I know there's a lot of questions that will come in. For Dr. Pam and Dr. Okumu, and we're not done yet. As I mentioned earlier on, we do have experts in their own rights. Mine is just to try and make sure when they're sharing, they do not use more than 10 minutes. I'm having fun with this. They're really keeping time. But thank you very much. And what has happened is we had Dr. Pamela coming in, looking at the aspect of adolescents and sports. Of course, please go back to the previous slide because we really need to thank our partners, the people who have made this particular virtual roundtable possible for us today. And we think the support of the partners, and we look forward to working and engaging with these partners as we go on. But we've also seen Dr. Pamela talk about preventative aspect, and we've also seen Dr. Kumu bring in that particular word. We need to look more into preventative aspects instead of curative ones. So let's have mikakati ziwekwe in place before they get hurt. So ladies and gentlemen, as I mentioned, this is a virtual roundtable. It's been brought to you by YIDP in collaboration with all the partners that you're seeing displayed on your laptop or your mobile phone. So we'll just move in because of time. We'll move into the third expert before we open it up for all of the partners who are here. Michael Omer is also one of the speakers. I know I saw him here. Michael is the executive chairperson for Global Health Association of Kenya. And of course, when we're talking about partnerships, there's some names that have to pop up while we're having these deliberations. And yes, thank you, Dr. Kuma, for speaking. So Michael is going to let us know how innovative can we be, especially with PPP. Now, ladies and gentlemen, everybody's talking about funding right now, but what we've realized is we really need to push on domestic funding. But then we've seen also donors say, hey, how about domestic funding plus private sector investment? So we're trying to figure out how innovative can we get? What do we need to do in order to make sure that the private sector is also interested in what we're doing? Because don't get me wrong, for private sector is always the ROI, return on investment for them. If it works, they will invest. But how do we become innovative? How do we capture them? And Michael, I know you're going to let us know if there's a shortcut to this so that we can start working on it as soon as possible after this call. Do let us know, but briefly introduce yourself and then take us through your presentation. Welcome.
All right, amazing. Thank you so much, Lizzie. I'm Michael Ouma. I'm the Executive Chairperson of Global Health Association of Kenya, which is a pioneering organization. Of course, I'm sure it is not familiar to quite a number of people here. This is an exclusive network of global health enthusiasts or professionals, and we are focusing on advancing global health standards in Kenya. So I'm really happy to be here. And what really makes me happy with this conversation today is that it's very timely. And of course, we've had a very beautiful conversation, introduction, and all that. But again, then now we are delving into the real issue. Now we want to, when you're talking about innovations around the financing and even the partnership, this is where now we must have honest conversation, a very honest and robust conversation. So I'm happy to be one of the speakers today. So I'll say good morning, good evening, good afternoon to everyone based on your location. Thank you so much. So today I want us to discuss, something that affects every single one of our countries, because I believe we are the audience that we have here is basically the South, that we are addressing our issues, the global South. So I'm happy that we are here to address what really affects our countries and how we can keep our young people healthy through sports when traditional funding actually right now is disappearing, especially the ODA. Now, let me start with a story that might sound familiar to us. I don't know how familiar it is to a number of us. Now, in Lagos, Nigeria, there is a community center that used to run after school football program for teenagers. Now, the international donor that funded it for 5 years just pulled out. And, the government health budget is already stretched thin. Now, the kids are back on the streets, and childhood obesity rates in that community have doubled. So you can imagine the impact. Now, this story is playing out across the global south. But if I told you that there is a way to not just save programs like this, but make them better, bigger, and self-sustaining. So that's what we are here to at least discuss today and to put our heads together and see a way forward for the global south in matters sports. And I think I'll take this opportunity to a little bit brag. Or when we're talking about sports, I'm a Chelsea fan. I have to brag. You know, I don't have to mention the rest. I'll annoy the rest of the audience. Thank you. So, so what are I want us to understand the crisis that we really have. Let me paint the pictures of where we are right now. Now, first, the money is disappearing. That's the reality. The official development assistance, the ODA that I mentioned, that's the fancy term for international aid money. It has dropped by 70% since 2021. To put this into perspective, if your country was receiving, let me say, example, $100 million in health aid in 2021, you are now getting only $30 million in 2025. So that's a huge drop. So, but here's the kicker. Now we need that money more than ever. Public health emergencies have jumped from 152 in 2022 to 213 in 2024. So that's a 41% increase. We are talking about disease outbreaks, natural disasters affecting health systems, and other crises that stretch our already thin resources. So let me make it real with an example. Imagine you are running a household budget and your income just got cut by 70%, but your expenses went up by 41%. You would be in a serious trouble, definitely. So that's exactly where Africa health system are today. And I love how Dr. Pamela had mentioned it. We really have a heavy weight to lift as Africa. We have a heavy weight. Now, for Abuja Declaration, 24 years ago, African leaders promised to spend at least 15% of their national budgets on health, and it was called the Abuja Declaration. So today, only 3 countries have kept that promise consistently, which is Rwanda, Botswana, and Cape Verde. So that is really, really troubling. That is very, very troubling, right? If we have to be serious, that is really, really troubling, you know. So why does this matter for sports and adolescent health? So because when governments, it matters because when governments can barely fund basic healthcare programs for young people, especially preventive programs like sports, are often the first to be cut. So uh, this is very critical conversation that we must have. Now, here's a silver lining that we can, have a look into. Now, the Africa CDC, our Continental Health Agency, has not been sitting back and crying about this crisis. I'm happy. They are leading a revolution in how we think about health financing. They are saying instead of depending on donors who might leave tomorrow, let's build our own sustainable funding systems. And this is where sports becomes a game changer, literally. And I'm really happy. I hope if we are already familiar with the I saw the Africa CDC have a concept paper which is on health financing, the new era. So it's a very beautiful document with a roadmap on health financing in the global south. It's a very beautiful document, which now I'll put it as we're looking at political goodwill across the global south to make sure that this is implementable and we are able to improve in terms of health financing in Africa. So why sports matters for health financing? So sport is more than just games. So when I talk about sports health programs, I'm not just talking about kids kicking a ball around. I'm talking about a comprehensive approach about that combines the following. It combines physical activity that prevents obesity, diabetes, and heart disease. It combines mental health support through team activities and structured programs. It combines life skills education, including nutrition, leadership, and conflict resolution. It combines community building that strengthens bonds and reduces crimes. So let me give you a concrete example from Ghana. In Accra, there's a program called Healthy Goals that combines football training with health education. So kids learn about HIV prevention during halftime. They get nutritious meals after training. Parents attend workshops on family health while their kids play. So you see the results, it's amazing. So the results, it's that amazing. So child obesity in participating communities dropped by 23%, and then school attendance increased by 15%. That's amazing. And here's the kicker: the healthcare cost for these families went down by 30% because fewer kids were getting sick. So it's just amazing program. It just tells you what sport really can do in transforming healthcare. It's just an amazing program, isn't it? Right? Thank you. Yes. So the investment case now. Here is why smart governments and businesses are paying attention. Every dollar invested in adolescent sports health programs returns $4 to $7 in reduced health cost, and then increased productivity and social benefits. So think about it as this way. It costs about $50 per year to keep one teenager in a comprehensive sports health program, but treating one case of adolescent diabetes costs about $1,200 per year. The math is definitely clearly simple. Now, so now let's talk about what are the public-private partnerships. Now, a public-private partnership is like a marriage between government, the businesses and community organizations. So where everyone brings something to the table and shares both the work and the benefits.
So let me break this down with a simple analogy. So think of building a community sports center with the health services. Government brings in the land, policy support, and the authority to make things happen. And then private companies brings in money, technical skills, and efficiency. And then the community organizations brings in the local knowledge, trust with the families, and volunteer power. So instead of government trying to do everything alone, or private companies only carrying about profit, or NGOs struggling with limited resources, they work together. So, and I'm happy there are quite a number of examples that we can give for example, in South Africa, but I won't delve so much into such details because I know Lizzie is looking at her watch. So we can adapt models, for adolescent sports health programs. So I want to highlight a few models that I believe can really be a game changer, especially on health financing, which aligns with the sports that you're trying to really focus on. So I'll highlight quite a few. So which I believe really are pragmatic and really realistic with the current situation and how things are really changing. Now, there are quite a number of models that I really feel are very critical and very important to help us, in matters to do with the health financing. But let me just delve into a few. Sorry. Now, model number one is it's called hybrid social impact bonds. Hybrid social impact bonds. In other words, pay for success. So think of this as paying for results, not just activities. Here is how it works in simple terms. Now, private investors pay upfront to fund sports health programs. Then programs run for 2 to 3 years with clear health targets. Let me say reduce obesity by 15%, then improve mental health scores by, let's say, 20%. Now, government only pays investors back if the targets are actually achieved. Now, if programs fails, investors lose their money, not the government. Now, in real world example, imagine a program in Kenya targeting 1,000 adolescents in Nairobi, informal settlements. Then private investors put in $2 million upfront. The program combines football, volleyball, health education, and nutritious meals. So success metrics are clear: 15% reduction in obesity rates, 20% improvement in mental health screenings, 25% reduction in drug abuse, and 90% maintained vaccine rates. So if these targets are met, the Kenyan government pays investors, let's say, $2.4 million, a profit of $400 for success. If targets aren't met, investors lose their money, but the government hasn't wasted taxpayers' funds in ineffective programs. Now, why this works? Governments gets proven results before paying. Private sector has incentive to make programs really work. And then communities get high quality services. And then lastly, successful models can be replicated across the continent. I hope we are together, Lizzie.
Yes, we are together.
We are. So much. Thank you so much. Now, on to model number two now. Now, model number two, I call it sports health tax advantage partnerships. The sin taxes for good. Sin taxes for good. Let me call it in quotes. Now, this model turns harmful consumption into health funding. Now, the concept is very simple. Many African countries are introducing taxes on things that harm health, i.e. sugar drinks, cigarettes, alcohol, gambling. So instead of this money disappearing into general government funds, we dedicate it specifically to sports health programs. Here is a practical example from Nigeria. Nigeria introduces 0.10 tax in terms of dollars on every sugary drink sold. So with 200 million people, this generates about $50 million annually. You can imagine. So instead of this money getting lost in the general revenue, 40% goes to building sports facilities, 35% funds private companies to run programs, and then 25% supports community organizations. So this is how really beautiful this looks. And in terms of how partnership structures can come into at play in this kind of a model, government creates the tax policy and collects the money. And then private companies builds facilities, provide equipment and train coaches. And then community organizations, the CSOs, run local programs, engage families, and provide cultural knowledge. So these are amazing, and I believe is a brilliant idea that we can incorporate so that for a sustainable financing. So why this is brilliant for me, people consuming
Can I double check? Collins, is it my network?
Not really. I think it's
Oh, okay.
Michael's. Yeah.
Oh, it could be it's Michael's. No worries. I was really getting excited about the syntax. But ladies and gentlemen, we'll just give Michael another minute and see whether he's going to join us. In the meantime, because we cannot talk about sustainable financing if the numbers are not being, discussed. And that's the reason why Michael was giving out a lot of examples that have worked and can be replicated. And we're hoping we'll get him back. But before he comes back, maybe we can go to the Q&A aspect, and we do have somebody who's going to start us off. And this is just ideally to hear from you. I'm pretty sure most of the people who are here have examples of things that are working that can be replicated, or have more questions to the speakers that have already presented. Maybe let's go to the next slide. The previous one, I believe, should be the previous slide. Oh, yeah, that's the one. Now, to open up the discussions, no, it was the correct one. Sorry, Kevin. I think I'm the one who's taking you back. My apologies about that. Yeah, the next one. And the next slide for the beautiful lady. So for us to open up the Q&A discussions, we also have somebody who would like to chime in and give us a little bit of feedback on what they're doing. Chelimo, are you on the call? I just want to make sure we can hear you and we can see you. And ladies and gentlemen, we only have 20 minutes, so it's open up for you to also let us know how you feel about today's discussion. What are your inputs? And I'll just call upon Chelimo if you're there.
Hello.
Hey, how are you?
Can we have Dr. Susan Getao speaks to the issue of substance use in the young people? She's doing a lot of testing around substance use, and being an ISAP member, I think she can take it up. I can't see Chelimo.
Okay.
Unless
Okay.
Chelimo is here, Susan can take it over.
Oh, Susan, yes, I've seen Susan, but I'm also trying to locate Chelimo on the
Chelimo, yeah.
yes. So Susan, please.
Chelimo should.
Yeah.
Thank you so much for
Yeah.
Chelimo, if
having
you are
me.
in, please. Yes. Susan, go
Susan,
ahead.
please proceed.
Thank you. I'm so glad that I joined this meeting early enough. And I've really enjoyed the conversation because you learn every day. What I've come across when it comes to sports, there are other things that are going on behind the scenes that probably a lot of people are not aware of. And I'm talking of sports even in high schools. I'm talking about sports within where I am in the villages, where now people know that if I tell my parent I'm going for sports, the parents are very excited about that. But we have also learned, which is quite depressing, is that the peddlers target those places where the young people are going. So they know they will target them and influence them. And there's a lot of rumors going on that if you want to play, let's say for an example, Rouge or rugby, that you don't want to feel the pain that when you're being hit by the others, they always influence them that probably if you use marijuana, you won't feel the pain and you'll be so focused in what you're doing. So I'm feeling we also need to remove the myths that are associated with substance use. So you're finding that sports is a good thing and the people who are really motivated are able to go, but there are those others who are now influencing these young people into using substances, whether it's marijuana, whether it's alcohol, whether it's tobacco, but they're doing it for themselves. So as the other speaker was speaking, and especially Dr. Pamela, she brought in the fact that these people who are doing sports, they should have some kind of education on substance use and how it is introduced there. So prevention would be the best thing. So the parents should be well aware that this is what is happening on the ground. The coaches there, the people there who are now the coach, the people who are guidance, they should also have a kind of education so that they would motivate these young people not to go towards sports, towards substance use for whatever reason that they are given. That it is noting that when you become a celeb, what are we expecting you when you're a celeb? We expect you to buy for us alcohol. We expect you like to use marijuana. We expect you. So all these things are there on ground. So we really need to work better. I'm a full-time member of ISAP. I think I've been in ISAP for the last 9 years. And I've loved the work that we are doing, the collaborations that we are having with others so that we can help our young people because they're the most affected. As Dr. Pamela is telling you, we are testing substances. Shule zimechomwa sana. And I'm telling you, all the kids that are being sent to do a drug test, they are testing positive for marijuana and cotinine. Cotinine is what you get when somebody is using tobacco. They are not smoking cigarettes. They are either vaping or eating the raw tobacco, the one they call Chavis or Kubel. So they tell you alcohol, everybody will notice. These two things, rarely does anybody notice I'm under that influence. So thank you for this opportunity. And I pray that we'll continue working together and seeing what we can do to really help our young people. Thank you.
And thank you. And I think what we need, Susan, is more, also kind of bringing ISAPs and other partners work into the picture, because I can ask two questions. How many people have insurance cover right now? We're trying to push for share, shift, share, whatever it is, but insurance cover really matters. But ideally, being realistic, when you tell your parents or when your daughter or your son tells you, I'm going to attend a sport, you will never say no because everybody understands sports. They play sports every time they're out of the house, they're playing football, this is something that we can relate to. But there are other things negative to it that we don't want to accept, like kids, using substances just because one of the players was found doping. They also think doping is, and vaping now has been made a lifestyle thing. Everybody is just vaping. So we really need to have those candid discussion, not only with the athletes, but also back home, because that's where we start nurturing an athlete back from the house setup. Ladies and gentlemen, as I mentioned, we have 14 minutes, and this is just for you. The 14 minutes is for us to open it up, see whether there's anything you feel like maybe wasn't tackled enough, or you have an input, or maybe share an experience of what is going on in your own country, because we have different people from different countries who have attended this particular session. But as we were deliberating, a lot of thoughts came out when we're talking about, especially when Michael was talking about investments. I appreciate, and this is something we're trying to push from the CSO's perspective also, which is the sin tax. Let's tax the tobacco, if it's the vaping, if it's the soda, and these things are really working in Nigeria. I've seen especially the sin tax for the sodas and the sugar additives, and they've been doing a lot of advocacy around that. Now, the problem when it comes to an African setup is how do we tap into that sin tax, and how do we use that money to better this kind of deliberations and the life of athletes as we know it. So ladies and gentlemen, if you feel like you really have something to add, or you'd want to just air in your opinion on something, or you have a question that some of the speakers who are still here can tackle, do use your electronic hand and we'll give you a chance to do that. But I also would appreciate Susan and the team, if you guys can also drop your contact details, because I'm sure a lot of people would want to be members of ISUB. And also let us know if there are any other materials we can engage with. And thank you, Carol, for your input. I don't know whether, Carol, you're still on the call, you'd want to speak, or should I just read the comment that you've left behind? If Carol is still around, Carol, of course, feel free to unmute yourself. If not, I can read your comment, but feel free.
Hi, how are you?
Good, good. We can hear you. Over to you.
Yeah, apologies. I can't put my camera on because of where I am.
No
If that's
worries.
okay?
Yeah, yeah. No
Okay.
worries. Please proceed.
Okay. Thank you so much for inviting me to this session. Thank you so much for the conversations you're having. And I think so for myself, I introduced myself as a sports medicine physician. And I alluded to that because then when we don't have the right people in that space, attending to the athlete's health, of course, that area is tends to be overlooked. So I'm really glad this conversation is here, and thanks also to Dr. Okumo for his insights. Thank you to all of you for your conversations. I really like the question you asked about insurance. How many of our athletes, especially the young ones, have access to medical insurance? And even as they have that insurance, what health packages are there on offer for them? So how many get their heart checked? How many get their teeth checked, their eyes checked, in addition to what Dr. Kumu spoke about, their bones and their muscles. So just a holistic approach to the athlete, because once that athlete is healthy, they are able to perform at their best. So thank you so much for this. I would love to join the team or the conversations going forward, and help get solutions from within for what we are facing, and hopefully that can also bring on board the right
Don't feel
partners.
shy.
So thank you so much.
Great, thank you. Appreciate it. Angelina, I saw your hand up. If you don't mind, you can just unmute yourself, Angeline, and just give your insight or ask your question if you feel comfortable doing that, Angeline.
All right, thank you so much, Liz. I hope I'm clear enough. My name is Angeline from UNESCO. It has been a great discussion this afternoon, and recently I've gotten a chance to attend the East African Cup 2025 in Tanzania under the age of 16 for both girls and boys. And what I noticed about substance abuse was actually, it caught my attention because it was a week, 5 days, actually it was 4 days tournament. And what I realized is substance abuse among the teenagers is on the higher rise. And this call to action about, I noticed that we need to do more about safeguarding, because I had a chance to train coaches on safeguarding matters, and I asked them about the discipline of their team, of the team members, coaches. And from what I saw is like we are not really taking safeguarding issues in our right way, in the way that it's needed, because when we have the right policies and right safeguarding measures, we can't be able to witness the issue of substance abuse. And at the age of 13, 14, 15, I was using the kids, teenagers across East African community using, we call, here in Kenya, we call it bangi. Marijuana was also there. I was just doing a bit of round checking, and it really caught my eyes. And I had a discussion with one that I caught, a lady actually, and she was like, I'm 14 years, and she was like, our coaches doesn't care as long as we win. So those are the comments that came out from that lady. So if we have a correct policy measures and right way of disciplining, and when they sign the safeguarding policies, it will really help. So I believe with the safeguarding issues, discipline among the team and the players and the coaches, it's something that need to be looked into. And I've liked the way Dr. Pamela has talked about, she has really explained, and this also goes to how right now the country is having issues of anti-doping. We have seen in Kenya, we have lost a lot of athletes when it comes to doping issues. So it was a great discussion, and we are looking forward to having more and more of this discussion. Thank you so much, Liz.
Thank you. And I like the fact that everybody is funded. I've just read Lucia from you all the way from South Africa and see whether this is, and plus I love your rugby team. Yes, I need to just say that. I love Kenyan rugby team also. I'm not being biased. I'm just saying I also do love South African rugby and the way they play. Luzuko, do you want to just chime in? Then we can get Dr. Nicholas. Your hand is up.
Everyone. Hi everyone.
Hey, how are you?
How are you doing? I hope everyone is
Good,
fine that
good,
side.
good.
I'm in Kenya. I love that country. Anyway, guys, I just wanted to share my piece in terms of the sports and athletes and everything. You know, the challenge is at the grassroots level. I think where the problem is. We know part of our problems that we have in our government departments is corruption. So our focus mainly will not be there, even though most of our funding is deriving and is coming from there. But what we never see is the money actually going to where the facilities or where the sports creations, recreations, or sports arts and cultures is supposed to be, which it is not going to the beneficiaries. I think the speakers have spoken profound and have given such a nice report on the research on what is actually going on. And I think it's most of the countries. But what I can share is this: it's a good initiative to start as activists to make sure that most of that money does not actually just go unused or goes back to treasury because of it was not used or it was misused. So I think what is best is that we do continue with this, because it's more like we will be the people that's looking where the money flows to and how does it actually work in terms of these programs. Because I am also part of South Africa UNAC organization, which I'm working with an NPO that works with the non-profit organization in terms of drug abuse and helping most of the boys and girls that are using drugs at the poor of the poorest level. You would know what I'm speaking about, colleagues, but thank you very much for this opportunity. I don't want to
Thank
take
you.
too much time,
No worries. And
but I
thank you
would
for
be following
bringing
up
that
on
in.
everything. Thank you very much.
Thank you. I know we have 5 minutes. I'll just take it back to the speakers. Dr. Okumu, your hand is up, and then we can let Dr. Pam say something. And I know Mike is back. So we'll take it over to Dr. Okumu.
I just wanted to mention something. You had mentioned at the beginning that, athletes have a lot of money. And I just wanted to give some clarity on that. If you were to take any elite sports, whatever, name it, rugby, athletics, soccer, the percentage of the guys who actually make it and are successful and are able to earn a reasonable living from their sport is a very tiny fraction of the whole athlete population. So let's use a simple example of even our soccer leagues, for example. The people, the individuals who are playing in our national leagues currently do not even earn enough to take care of themselves. Literally, you'd have to get a contract to go to an elite European club, or somewhere else in Africa to be able to make the kind of money that would sustain you. And so I think that's the big issue we need to kind of highlight, that of all the people who play sports, very few will make it to that high level where they can really, make money. And so at the end of the day, our discussion here is about every athlete, and we've talked about younger ones especially. And so our focus really needs to be made on finding ways to finance sports so that every young person who wants to participate can have that opportunity. And as they are doing that, we need to find ways to make sure that we are taking care of them holistically. So the discussion here has been really good. We've talked about mental health. We've talked about, their physical health. But at the end of the day, we have to find a way where we can make this, sustainable. And so what my colleague has mentioned, the previous speaker, about addressing issues of corruption, bringing in the private sector, building partnerships that can build sustainable, long-term programs is really, really important. I think I just wanted to stress that a bit.
Definitely. And thank you for clarifying that. I always look at the glamorous one and, equate that to money. But thank you for bringing that out. Dr. Pamela, if you could also just give us your final thoughts around this before Michael comes in.
Okay, I really want to appreciate every one of us who joined in, and I know that this space is a strategy to really see how we can build sustainable systems around athletics well-being, so that we can expand also the professional mental health services to our sports. And it's not an option really, it's something that we have to do. And I want to say that our psychologists are available. We may not have the right ratio in the country or even in Africa, but the few that we have, we need to utilize their expertise. We need to help, reach out to them to get our athletes trained on emotional regulation, on preparing themselves mentally, even for a win or for a loss, on recovering from setbacks, because they will go to the field hoping to make money, hoping to win. They have a setback. Who is going to prepare them to deal with this? We need to really realize that they need this psychological support. So a true holistic approach to sustainable sports systems is very, very important. And as ISAP, I have seen Dr. Gakunju is here. I know he's a great advocate. They are our mentors in psychology. And I believe that this should go out there. We see how we can help our people. As ISAP, if we get some organized groups that need awareness creation, we will be able to mobilize ourselves to offer some awareness. Thank you.
Thank you very much. And we like that. We like when organizations are ready to assist. So civil societies and community groups who are here, ISAP is more than happy to start working with you. Michael, we lost you, but we were super excited about your input. Unfortunately, we've run out of time. We just want you to do a parting shot before we hand it over to Cavins.
Right. Thank you so much. I think, sorry, I right now even I'm not, you cannot see me because of blackout.
No worries. No worries.
It got me off guard.
Papa did that thing, yeah?
Yeah, it got me off guard. But I'm happy that at least we are still somewhere. Now, allow me, there's something that I really wanted to mention that was very, very important. Before I wind up so quick, allow me just to do that, because at the same time, I'm also competing with my gadget is also alerting me. It might go off, so let me do my best. So now I was at model number 2, right?
Yes, you were talking about the syntax. That's the last one you mentioned.
Exactly. I wanted to mention something in that, but let me proceed to the model number 3. Model number 3 is digital health sports integration platform, the sports health hub revolution. So of course we are in a digital space right now, where AI also does a lot of things. So this liberates Africa's mobile revolution for health, and the big idea is that it combines sports programs with digital health tracking, using Africans' widespread mobile phone usage, which is over 80% penetration, and mobile money systems. Model number 4 is community sports health franchising network. Quote unquote, let me call it the McDonald's of sports health. So this applies the franchise business model to health programming. Now the concept is just like the McDonald's, ensures the same quality burger in Lagos, Nigeria, or in Cairo. This model ensures consistency and high quality sports health programs across communities while allowing local adaptation. I don't want to delve into example because I think we are interested in time. So model number 5 is infrastructure linked sports health bonds, which is build it and fund it together. That's why I call it quote unquote. So this model combines building sports facilities with guaranteeing long-term health programming. So the innovation is, instead of just building a sports center and hoping someone runs programs there, this model legally links the infrastructure investment with committed health service delivery. How it works, this is how the bond works. The development banks issue bonds to fund sports facility construction, and then bond terms requires facilities to provide adolescent health programming for 15 to 20 years. Then revenue from facility usage or corporate naming rights and events pays back the bonds. And then environmental sustainability standards are built in. Then lastly, the last model that I would mention is regional sports, which is very important, very critical, regional sports health investment cooperatives. This will go a long way, because I think for the Global South, I think for quite long, we have not seen this really into action. So this enables countries to pool resources and share risks for bigger impact. Now, the cooperative concept is, just like farmers form cooperatives to buy seeds in bulk and share equipment, countries can form cooperatives to invest in adolescent sports health programs together. So how are the benefits for the region cooperation? So economies of scale, buy sports equipment and health technologies in bulk for lower cost, and then knowledge sharing, learn from each other's successes and failures, and then lastly, risk spreading, which is, if programs fail in one country, successes in others balances it out. And then stronger negotiation, lastly, which is very critical. Once we have a cooperation, like let's say East Africa, this is a bigger collective voice with international partners. I think that's a very critical model that we really can look into. So I would love to have delved into how this aligns with the Africa CDC strategy, but that I think would I would be messing up with the time. But let me just put out these points, which are very critical. Now, Africa CDC has declared that we are entering a new era based on their new concept paper of health financing. So what does this mean in practical terms? So we have 3 critical shifts right now that's already happening. So we need to shift from begging to building. Instead of constantly asking donors for money, African countries will build their own sustainable funding systems. So that is very critical right now. And then number 2, from single sources to multiple streams. So instead of depending on one big donor, programs will have 4 to 5 different funding sources. And then lastly, from hoping to knowing. Instead of hoping programs work, we'll use technology and data to know what works and fund only effective programs. So my parting shot, our call to action. I have to do this so quick. This Kenya Power have done for me that thing. I don't like it. All right, call to action. Now, the opportunity before us is clear: to turn Africa's health financing challenge into a catalyst for innovation, partnership and transformative impact in adolescent health. So we can build a future where every African adolescent has access to quality sports-based health programming, supported by sustainable sustainable financing mechanisms that strengthen communities and nations. So the models are ready, and I'm happy they are practical, and the evidence is clear. The technologies exist, the political will right now, I'm hoping they're building up. So all we need to do is the courage to act. So there's one thing I wanted to mention before. And this is, I'm sure Dr. I don't know, let me just, all right. I'm sure yes, Dr. Pamela will be really interested in this. I saw there's a letter our government was entering into in partnership with the BAT for health promotion, kind of a program with, you can imagine that. You can imagine that is coming. I'm mentioning that. I have to mention that really. It doesn't really add up at all completely. You know, these are the platforms where we can really call out these issues where the mess are happening. That is something for me. We have to call out. Yes, I wanted to look at the document itself, but since I can't trace it because of the power happened and all that, I wanted to trace it and be very accurate because I don't want to mention, be misquoted. But that particular happening was so misinformed. And I think we really need to call it out. If that document, we are familiar with it, we have interacted with it, we have seen it. So thank you so much, Lizzie. Thank you so much.
Thank you. I think we might need another session for just, sustainable financing so that we give you more time. I was very much interested in those models, but it's very unfortunate that now is when, the African continent has actually woken up to some things around financing. We should have already been using not a single but multiple donor funding for programs initially. Yeah, so that's me. As I mentioned, my work was to moderate. Sorry for taking 10 more extra minutes out of your busy schedule, but I'll hand it over to Kavins. Let's just make sure your internet and Kenya Power has not messed you on your end. Can you hear us, Kavins? Yeah, unfortunately, I cannot hear you, Kevin. So it might be your gadget. Maybe you can do it without your gadget.
Can you
Yes,
hear me?
better. Loud and clear.
Better.
Yes, over to you. Yes, over to you.
Thank you. Thank you very much. Okay, thank you very much, Liz, for moderating this afternoon session. It was very inspiring. It was very insightful. And I believe we've all enjoyed the session. I know time was very short, but I know next time we'll adjust on time accordingly. And maybe I want to thank all the members who are present today, all the participants, all the keynote addressers, all the speakers. I believe today we were not just passengers, all of us were crew members. So let us continue the debate going forward. And just to point out a few things, one is that we have a series of webinars coming. There'll be a couple of them at good intervals, starting with the next one on the 1st of August. So let's be in the lookout for that one. We encourage all of us who are present in this one to register for that one, as we also add others to this great course. Remember that the series of webinars are just meant to prepare us for the summit coming in November. So let us all build up towards this. Another aspect I want to bring to our attention is just to thank all of us and also thank our partners. We had thanked them when we were starting. We still are thanking them now when we are closing for the day, but also involve us all in the programs to come ahead. We are still encouraged to partner up with us and continue with the good course that we are doing. And I would want to echo one thing that was said. Let us all have the concerted effort towards this. This is when we'll have real-time solution to our challenges, especially in the athletes, the sports people. It's an area that is still gray, as we've been told. There are so many challenges, but let us not belabor the challenges. We already started and we are moving forward. So without speaking so much, just want to thank once again all of us for having a time this afternoon to engage in this very, very important discussion that we had today. Thank all of us. Thank you very much. God bless wherever you are. Stay safe. Do what you are supposed to do. Remember, when we use our words, they are very impactful to ourselves and others. Let us use them responsibly. Over to you, Collins, the CEO, for a closing shot.
And we hope you're a Arsenal fan, yeah? Not Chelsea.
I'm still an Arsenal fan.
Okay, thank you. Thank you so much, Kevin. And thank you so much, our partners, delegates, for such an informative discussion. And there is one important thing that is coming up that Kevin's quoted. That's about our series of webinars that will be happening after every 2 weeks in partnership with our partners, which you can see there: III, ISAP, KMA, ACRCC, HUGS. So we have many streams of partners coming in, and we will urge you to join us, making this a reality. Every journey starts by a step, and you can never make it if you are alone. We really need to join hands to make sports spaces a safe space for our adolescents, and also we take advantage of the resources that are already in place. So there it's our webinar coming 1st of August. That is unseen injuries and addressing mental health sequelae of sports injuries in young African athletes. So we have so much full day, not full day, but 1.5 hour time of discussing about a lot of mental issues that our young athletes are facing. Over the research that we've done lately, we've noticed that young people within the community really tend to make sports or sports places a safe space. And now it's upon health experts and private entities, that is, those both public and private entities, to take advantage of this by having integrated programs that will really make or build a healthy, sustainable community for our young people. I don't have much to say. We have, this is a build-up of the summit. Kevin, if you can go to the next presentation. So that is the summit which is coming on 19th and 21st of November. It will happen at the Cloud Suite Hotel in Nairobi, Kenya. So feel free to join us, and feel free also to join members of our partners who are making this mobilizing resources to make this great day a success. So there is our contact. That's partnership@ydpk.org. And if you want to learn more about the summit, go to the website that is stipulated on that, so that you can learn more. And if you also would like to speak and also to participate in one way or the other, feel free to reach out to us. So with those few remarks, may God bless you. I'll ask you now, you can leave at your own pleasure. We have an entertainment. Maybe, Kevin, you can put for us some music so that we can dance while we are dialing out. So see you in our next webinar. May God bless you. Bye.
Have a great day.
Michezo ni furaha, mchezo ni dawa. Kimbia na ndoto zako, usichoke wala kuwa. Mwili wako ni gari, akili ni ramani. Safari ya maisha lazima iwe safi. Twende sasa, tusonge mbele. Nguvu zetu zishinde vikwazo. Fanya mabadiliko.